Hello, and welcome to ACOG's annual clinical meeting in 2016. You've probably realized at this point that a new structure called flipped classroom will be in play for this course. You will review 3 videos that I will give you course lecture in advance, and then some articles to follow. And when we meet in Washington, D.C., I will present a host of cases to then further give you information on the things we're talking about today. So probably the most important thing that you see in your office is the patient who's in a sexless marriage. Something is happening in that marriage or that relationship that the sex is not occurring. In my practice, sometimes I see couples that are 2 years with no intercourse or intimacy. I don't know why they wait that long, but in fact it happens. So let's talk about some of the most common causes for a sexless marriage and things that you can do as a gynecologist and obstetrician to make this change for your patients. The first has to be painful sex. 50% of my patients that are not engaging in sexual activity don't have sex because it hurts. It can be because of atrophy secondary to the loss of estrogen at menopause. It can be atrophy from chronic prolonged birth control pill use in younger women. It can be from vulvar dystrophies like lichen sclerosus and lichen planus. And it can be from other things such as vulvar vestibulitis. It's important that you address these complaints in the office to some degree and at least have the conversation going. There are absolutely things you can find on a focused exam that can direct you in one way or another, and perhaps at least get some kind of treatment initiated. This topic is so important that I've reserved a complete video for this. So we'll stop at this point, and you will find more information on painful sex in video number 2. So let me go on with the second most common thing we see: bitterness and resentment. It happens in all relationships. You fight over kids, you fight over work, you fight over money. This bitterness and resentment lowers the dopamine and norepinephrine in your system and makes you flat and low desire for sex. As you keep harboring these negative thoughts, the sex gets less frequent. The less frequent the sex, the harder it is to reinitiate. I would often suggest that people try and compartmentalize their life, try and separate the bitterness and aggravations of daily life, and try and keep the sex separate. Because I would argue that if you had sexual activity, it would reboot your dopamine and norepinephrine and perhaps help undo some of that bitterness, and you would forget what you were fighting about in the first place. Be nice to your partner. Mutual respect is desired by everyone. No one wants to have sex with someone that they're fighting with or arguing with. No one wants to have sex when they're being criticized by a partner unfairly. Think about these things and encourage your patient to talk nicely to each other, show evidence of mutual respect on a daily basis and the importance of each partner's role in the relationship. Try and compartmentalize sex away from the fighting and bitterness of life and make it an absolute important thing that this happens on at least a weekly basis. Poor function is another reason for having a sexless marriage. No surprise that with aging, especially starting in the 40s and 50s, that the ability to achieve or maintain an erection becomes challenging. Often this goes undiscussed because everyone's a little bit embarrassed. So the male partner rushes to complete the encounter. While doing so, he usually robs the female of her ability to have an orgasm because she senses his loss of erection coming, so she is rushing to try and have her orgasm. And of course, that is the kiss of death in women. Anytime they are distracted or rushing for an orgasm, it's almost always going to be derailed. Many causes of erectile function issues in men are organic or have medical causes. We certainly know there are psychological causes for ED, but many are medical causes. Some of the most important are cardiovascular disease and hypertension, and the medications that are used to treat them. Other causes are smoking and alcohol abuse. I talk to young people early about smoking cessation and the negative effect that that can have on erections down the line. Regarding medications, there are many in the same category that are less negative on sexual function than others. So we need to discuss the list of medications and try and modify the different meds the patient is taking while working with their primary care or cardiologist in doing so. Remember that many of these medications are being taken because of a lack of healthy living. You must diet on a regular basis, keep a clean diet, keep exercising on a daily basis. These two things, when you don't do them, contribute to obesity, diabetes, hypertension, cardiovascular disease. So start early in life, exercise regularly, eat clean, and keep your function going on a regular basis. Boredom is another reason for low desire and a sexless marriage. Many women tell me that while they like sex and they can have orgasm, they just don't want to. They say it's the same thing every time. They know exactly what steps will be taken from the time he initiates the kiss, if there is any kissing, and to the end when there's orgasm. So they can have a completely satisfying sexual encounter and have absolutely no desire to repeat that anytime in the near future. Boredom is routine, and sometimes we need to step out of our routine and remember what was sexy in the first place. For the ladies, doing role playing or wearing a little sexy outfit, naughty schoolgirl is always a good one, are ways to change the appearance. Remember, your man is visual and he wants to see you. He wants to see you in your outfit. He wants to see you naked. So give him a visual turn on by changing it up. Maybe not the sweatpants and ponytail. I think it's important to send little texts to each other during the day in anticipation of a nice encounter in the evening. They can be naughty texts, just make sure they don't go to the wrong person. I think having a date night and going other places to have sex, perhaps don't get arrested in a park, but find a hotel room or somewhere else that you find relaxing and fun that can create a new adventure and make it not seem like the routine boredom that often happens in your own home. Sometimes the home reminds the woman of all the things she needs to do. So she keeps thinking about her laundry, her ceiling fan that needs to be dusted. She's thinking about the wallpaper that's peeling in the corner. And these are all distractions. A blindfold will easily remedy some of those distractions by slipping that on and shutting out the environment that she has to look at. And perhaps that might also enhance her sensation during the encounter. Low sexual desire is experienced by 10% of all women in many reports and studies. Today, we now have a drug available for low sexual desire that has recently come out in October. It will not be the remedy for all of your patients, but will certainly be an option that we can discuss at the meeting. So we'll talk further about low desire. We'll talk about the management that's available both on-label and off-label, and we'll get you giving better advice to your patients and try and improve a sexless marriage.